In STEM 17, we're going to be looking at the actions that are needed to address Australia's health priorities. On the left-hand side here, you can see the dot points that we're going to be learning about. Again, like in the previous STEM, because this dot point is quite large, we're going to break this STEM up into two different parts. So this first part that I'll be covering will be looking at health promotion based on the 5 action areas of the Ottawa Charter, with in particular emphasis being placed on the levels of responsibility for health promotion and the benefits of partnership in health promotion, example, government sector, non-government agencies and the local community. The second part of this STEM will be covered by Mr. Sullivan, will be how health promotion based on the Ottawa Charter promotes social justice and the actual Ottawa Charter itself in action. So first area we're going to look at here is going to be the health promotion, as we previously said, health promotion based on the 5 action areas of the Ottawa Charter. But we're going to start off by looking at the actual levels of responsibility for health promotion. The first thing we can notice here, this is a really important point, it just states that health promotion is all about prevention. So if at an early age, or younger age for people, if prevention attitudes can be developed, so we can start to educate people about the importance of preventing different things which are going to impact their health, then the chances of achieving positive health outcomes are significantly improved. An example, if we can try to encourage people to put sun cream on from a young age, at an older age, they're going to be in the habit of putting it on, less chance of skin cancers being developed, so we're promoting positive health outcomes. But as we said here, we're going to break this up and look at the different levels of responsibility for health promotion. The first level we have is the federal government. The federal government, they're responsible for the leadership and providing some coordination to all the different levels of responsibility underneath them. They need to interact with obviously the more leading parts of organisations around the world. For example, here we've got the World Health Organization. That's someone there that the federal government would be, interacting with to find out information and be learning about different things relating to promoting health and making sure they can pass this information on to people below them, such as our state and territory governments. So that's the federal government. Just looking at leadership, coordination, and in particular, coordinating between other world leading bodies in relation to health promotion. Underneath the federal government, we have the state and territory governments. They're responsible for delivering preventative health services to people that are in need. That's the main thing we need to look at here, is making sure that they're going to be delivering preventative health services. So they've got the funding, they've got the money from the federal government, and they've got the leadership, and they've got the information from the World Health Organization. At the state and territory governments, we're looking for them to implement preventative health services that are going to help support the health or help support promotion of health amongst the people under their control. Some things you're going to be looking at would be, prioritising the health spending, making sure that the areas that are in real need of the spending is where the money is being allocated and it's not being wasted. Establishing healthy public policy, meeting accountability and public health goals. So things that are important in the public system for people to really be emphasising with their health, making sure that it's looked at. They also need to work cooperatively with different people, different levels of government, non-government agencies, as well as communicating closely with the communities and the public about health promotion initiatives and programs, and emphasising them, making them important, making people aware of them from the state level. The next level of responsibility for health promotion is the private sector. The private sector has a responsibility, as it mentions here, to contribute to the overall well-being of the population. They need to work to protect the environment, providing goods, services and working conditions that contribute to achieving healthy outcomes. So making sure that where people might be working, where people might be living, different resources that are being used, that they're at a level that's suitable and that people are going to be able to achieve healthy outcomes by using them. A little bit closer to the ground level here is the local communities. The local communities, again, operate underneath their state territories, state governments, I should say. They need to develop partnerships to provide safe environments and relevant health services to meet the public demand. So things that are in demand, different health promotion initiatives that are happening around the area, the local communities and governments need to really make sure they're emphasising these things because they're in demand of the community. Identifying specific needs of the local groups and addressing the critical determinants of health in the community are the most important tasks in achieving positive health outcomes in this population. So again, trying to get people in your local community, to be on board and to be promoting health at the local level, which in whatever way they may be doing it, is a real good way of emphasising people to make the correct decisions in regards to their health. The final area we've got for responsibility is looking at individuals. And I suppose this, to me, is one of the most important areas, is that individuals must take responsibility for their own health. If you're making poor decisions, then you can't worry what the federal government's doing because you're making poor decisions. However, individuals are only able to make decisions if they've got the knowledge to make the correct ones. So if individuals aren't achieving or learning the information they need to be seeing to make these decisions, then they're not going to be able to make healthy decisions to contribute to their well-being. The other thing for individuals is that they can contribute to the health of the community by supporting their families and friends and by actively participating in community activities that are designed to promote and protect the health of the wider population. An example here I've put down for you just so to help you with understanding is once a year there's, and I think it's held on Mother's Day every year, there's a breast cancer walk around Parramatta Park. So individuals here can support. Now, I can go and walk, and I have participated in this walk before, to support people from my family or friends that have been, have suffered from breast cancer. So by me going and supporting that as an individual, I'm helped to promote and raise money and awareness more for health promotion. So there are different levels of responsibility for the health promotion. The next part of our dot point talks about the benefits of partnerships in health promotion. Right, so the benefits of partnership. What's the good of having partnerships for health promotion? So we've got government sector, non-government agencies and the local community. The term they use here a lot, which I'd love to see our boys start implementing to their answers and instructions and responses, intersectoral collaboration. It's a term used to describe combined action taken between agencies, that we can talk here about government and non-government, from within the health sector and agencies from outside the health sector. It can occur between government and non-government or a combination of both. I think the important part here, remembering this is going to lead into the Ottawa Charter, but when Australians are given the opportunity to participate in decision and planning relating to their own health, they have been shown to be more accepting and trusting of these decisions. So by people being able to, so individuals at the local level, if individuals later have more input into what things they need to be implemented for their own health, there's more chance of them actually implementing these changes, as opposed to things just getting thrust upon them without really having any input from the local people, the individuals and the community. There's less chance of that policy taking off. Health promotion policies and strategies based on contributions from the people whom they are most likely to affect will benefit from an increased community involvement in the health promoting process. Let's go back to my example on the breast cancer one. So it talks here about health promotion policies, contributions from people from whom they are most likely to affect. So we've got people that have suffered from breast cancer. We've got a large number of women that go through breast cancer problems every day. By people in the family, if they can come on board and start to, contribute to the promotion of breast cancer, male or female, old or young. Young children walking with their mother, young children walking with their father because the mother's died of breast cancer. They're making it aware, they're supporting it, they're promoting it, and it can also help in the process of promoting what they're trying to do in terms of cancer. So that talks about the benefits. That's why it's so important to have different levels of benefits happening, or partnerships, I should say, for health promotion. The more people we can have on board working together to promote health, the better off it will be. I've just got an example here for you to support what we've been trying to say. But up here, the Learn 2, for that last dot point, says, argue the benefit of health promotion based on individual communities and governments working in partnership. And we've just come up with the Breast Screen Australia. And straight away it says here, a joint Australian, state and territory government program. So already we can see that there's some communities working together. As it states here, the most successful health promotion campaign in Australia provide us with outstanding examples of how individuals, communities and governments have worked in partnership to produce greatly improved health outcomes to the population. And the example I've got here now is the Breast Screen Australia. This program is a free screening program that looks to maximise early detection of breast cancer. It's obviously targeting women at 50 to 69. However, younger people or older people, females, are also able to go and have their breast screened. The reason why they've picked this age group is because these are the most common, where the risk is going to occur, and people get most of their sickness from the condition. The program operates in over 50 fixed, relocatable and mobile locations, so they're everywhere, which is outstanding. The state and territory governments have primary responsibility for the implementation of the program at their local level. So again, we start looking at the levels of responsibility. The state and territory governments are responsible for the implementation of Breast Screen Australia. The Australian government provides the overall coordination of policy formulation, national data collection, quality control, and a few other areas. So the government's got some roles to play. The state and territories are implementing it. Health departments. So some government areas here. And the Cancer Council in all states and territories advertise and promote the breast screening services. There's another level of argue the benefits of working together. General practitioners, so our doctors, as well as organisations and local community groups, help promote the use of service to the women in the targeted group by different awareness at the local community through advertising. Doctors, general practitioners might have flyers up on their, in their surgery for women to see. As a result of this is when we talk to arguing. So we can start to argue the fact that we've got the Australian government, we've got the state government, state and territory governments, I should say. Sorry, we've got health departments, we've got the Cancer Council, we've got general practitioners, we've got individuals. So we've got people going and being screened because there are over 500 fixed, relocatable and mobile locations. A little bit of equity there. People have the opportunity to go and get their breast screened. As a result, in New South Wales, the Cancer Institute provides ongoing scientific research while local governments provide sites and access. As a result of these programs, collaborative programs, people working together, breast cancer mortality has declined from 62 deaths per 100,000 women aged 50 to 69 in 96 to 52 deaths in 2005. So there's a reason to argue straight away there. Because we've got different levels of government working together to be promoting breast screen, we've had a drop of 10% over the last 10 years of women dying from breast cancer. And I think that's fantastic. 10% per 100,000 women, which is outstanding. There's a reason to argue for it.